Okay, hello and welcome. So, just to introduce myself quickly, I'm Margaret Crane, and I'm a therapist at the Child and Adolescent Anxiety Disorders Clinic at Temple University. And I'm also a clinical psychology graduate student. And tonight we're going to be talking about how we can support anxious kids, and we're going to be giving you some strategies for that. You all are welcome to introduce yourself in the chat if you'd like. You could say what grade your child's in. That's completely optional, though. So tonight we're going to be discussing how to recognize anxiety, and then also some strategies that you can use, and then also thinking about how to find treatment for anxiety. So when is treatment needed, and if you want to do that, how to find a therapist. And then at the end, we'll have Q&A. And again, I'll turn the recording off for that part. I just want to note that you all submitted some really great questions ahead of time. So I'm going to try and answer a lot of those throughout. And a lot of those questions that were submitted ahead were asking for strategies. So hopefully I'll cover a lot of those. And at the end, feel free to ask for clarifications about how to use those strategies for your child as well, if you'd like. So what is anxiety? Anxiety is a person's natural response to stress. It's a feeling of fear about what's to come. Some level of anxiety is common, and it's not always a bad thing. It helps motivate kids to do homework, to look both ways before crossing the street. And also just it's a natural emotion. We all have many emotions in our life, and some are good ones like happiness, and some ones are hard ones like fear or anxiety. But those are okay, and we want to have all those emotions as part of the human experience. So when does anxiety become a problem? We think about, does it cause a child a lot of distress? So sometimes anxiety isn't getting in the way, but a child just feels stressed all the time and they're not as happy as they could be. We also think about, is anxiety getting in the way? This could be in many areas of a child's life, like school, with friends, or at home. We like to note the at home part because for some kids, anxiety doesn't cause them problems, but their caregivers have totally changed their routines to make the child feel less anxious. We also ask, is it developmentally normal? It's normal for little kids to worry, for example, about being away from their caregivers. But for kids who are around age 10 or teenagers, that type of separation anxiety isn't as normal. And we also ask, is anxiety out of proportion? Sometimes kids worry about things that really are scary or dangerous. And in this case, these worries make sense. For example, if a child lives in a dangerous neighborhood, but sometimes a child may worry about a dangerous situation more than what's helpful to keep them safe. Anxiety is super common. Everyone feels anxiety at some point or another, and anxiety disorders are the most common type of mental health problem. So while we all do feel anxious, around 10% of youth have what's called an anxiety disorder. And having an anxiety disorder just means that anxiety is getting in the way or causing a lot of distress. So some people always have anxious tendencies, but having an anxiety disorder isn't something that has to be a lifelong problem. There are strategies you can use to help your child cope with anxiety, and there's also many treatments that are helpful too. And as an aside, anxiety disorders are even more common with adults. Around 20% of adults have an anxiety disorder. And I think over this last year, last few years even, everyone has felt a little bit more anxious than usual. Anxiety can be seen in youth with other problems too, like depression or externalizing disorders, like attention deficit hyperactivity disorder or behavioral problems. So in a little bit, I'll talk about how to know if attention or behavior problems are related to or separate from anxiety. So this all said, while anxiety is really common, anxious kids are referred less for help because maybe they're not the squeaky wheel, or anxiety is kind of normalized. This said, it's important that these kids get coping skills to help them too. There are many types of anxiety disorders, and tonight we're going to be talking about separation anxiety, social anxiety, and generalized anxiety. And that's because those are the most common types. And before I get into these, I just want to also say that oftentimes, and even more often than not, kids have more than one type of anxiety disorder. And that's just because the way we diagnose things classifies disorders based off of different types of worries. So a child could be worried about what other kids think of them. They could be worried about school. And for whatever reason, that's called two different types of disorders. So that doesn't necessarily mean that a child is more severe. It just means they worry about different areas. And so for each of these, I'm going to be going through some general symptoms, and then I'm going to describe some specific ones for kids with anxiety. And throughout this, think about how these symptoms might be relevant for your child. So the first is separation anxiety. So separation anxiety is worrying a lot about being away from a caregiver in a way that isn't developmentally appropriate. So I mentioned that part that it isn't developmentally appropriate because, again, it's normal for toddlers to worry about being away from their parents. We see separation anxiety more in younger kids, but it's also possible to see this in older kids too. And separation is key in this disorder because these worries come around when they're away from their parent. These kids might worry that something bad's going to happen when they're separated. Their caregiver or they might get sick or hurt or an accident. Kids might also have bad dreams about being away. Oftentimes, these kids have trouble sleeping alone, or they might not want to go to school in the morning, even though they like everything else about school. They just don't want to be away from their caregiver. So, to help you recognize separation anxiety, let's take Sophia as an example. So, Sophia has trouble at drop off. So, for school or play dates, she becomes visibly upset when she has to be away from her mom. She asks a lot of reassurance seeking questions like, is mom okay? Mom's just gone to the grocery store. She'll also call or text her mom throughout the day just to check in and make sure mom's okay. And this is hard for her mom because her mom finds it really distracting when her mom's at work. Sophia has bad dreams about being away from her caregivers, and she doesn't like sleeping alone at night as a result. And so during COVID, we saw that some kids with separation anxiety were happier with remote school. They got to be around their parents a lot. It was great for them. So the transition back to school might have been more difficult for these kids. We also saw after the different breaks this school year, so after winter break, after spring break, some kids with separation anxiety had a little bit more trouble during those times of transition. So next we have social anxiety. As the name suggests, this involves worrying in social situations. Often these worries are about what other people will think of them, or that they might embarrass themselves. And these worries can come about with things related to school, so raising their hands in class, giving a presentation, or social situations. So talking to other kids, inviting a friend over to get together. And as a result of these worries, these kids might try and avoid social situations. And we see social anxiety a little bit more in older kids. So often this might come about more once a child's gone through puberty, but this can be seen in younger kids too. So if we think about older kids, they care a lot more about their friends. They're, thinking a lot about social media and their appearance and what other people are thinking of them. So developmentally, they start worrying more about what other people are thinking of them. So to recognize social anxiety disorder, let's take Marquise and consider if your child has similar worries to Marquise. So while, all teenagers might worry about what other people think of them, we think about social anxiety as when a child has many of those worries and those worries start to get in the way. So for Marquise is really shy. He's nervous in performance situations. So he hates giving presentations in class. He avoids answering questions. He'll kind of look down, try and avoid the teacher. He doesn't like talking to strangers. He'll ask his parents to order at restaurants for him. And he's just generally hesitant to participate in social situations. And because he doesn't really contact his friends very much or approach his friends in groups, he just has some trouble with his peers because he doesn't reach out to them much. This all said, not all kids with social anxiety are shy. Sometimes they're the class clown and they're acting out because they're nervous about being around their peers. And during COVID, we saw a few different things. Sometimes kids with social worries didn't mind Zoom school. We also saw perhaps that they maybe didn't keep in very good touch with their friends, or they really liked communicating with them virtually. So again, the transition back to in-person school might have been hard because now they had to socialize in a different way, and perhaps with kids they didn't know very well. So especially for kids who are at a new school or at a time of transition, so going into middle school or high school, if they're going to be meeting new kids and they really only knew those kids before virtually, it could be harder for them when the transition was back to in-person school. So next we have generalized anxiety. So again, think about if this might seem like your child. So this involves worrying about anything under the sun. So kind of general things in everyday life. And these worries are hard to control, meaning that once they start worrying, it's hard for them to stop. You might notice that they kind of just always seem to be worrying. You call them your little worrier. Younger kids often might worry about things like safety, whereas teens might worry more about things like grades or homework. Younger kids also might be more afraid of specific things like dogs. So they might have like a specific phobia, but as they get older, these worries kind of start generalizing to other things. So they become afraid of more things. This all said, this doesn't mean that these worries can only, older kids can be worried about safety too. Younger kids can be worried about homework, even if they just have one math worksheet all week. And it also doesn't mean that just because a child was afraid of dogs as a little kid, that they're going to develop generalized anxiety. I just mentioned this pattern because sometimes parents notice it and kind of can think, oh, that actually does sound a lot like my kid. So anxiety overall, but especially generalized anxiety, includes physical symptoms. So kids might be fidgety or have restless energy. They might feel easily tired or have trouble concentrating or be irritable. They can hold tension in their body, and so that can lead to muscle soreness. And oftentimes these kids have trouble sleeping because they're staying up worrying. So to recognize generalized anxiety, let's take Charlie as an example. So think about if your child seems like Charlie. So Charlie is a perfectionist about their work, but frustrating to their parents, they avoid work for fear of making a mistake. They'd rather not turn a homework assignment if they're not sure it's perfect. Charlie always wants to do the right thing, and they get upset even if they're mildly scolded. They seek a lot of reassurance seeking questions like, did I do that okay? Are you mad at me? Um, or is this a safe thing? Did you lock the doors? And they just kind of can appear jittery, tense, or unable to relax. And Charlie has a lot more health worries right now. So, not necessarily worrying about COVID, but just COVID got them thinking more about health. And so they're starting to worry more about, is grandma going to get cancer or things like that. And the other thing we've noticed with COVID is that uncertainty is heightened right now. For example, if kids now have to wear masks in school or they don't have to wear masks in school, if there's now quarantines because of COVID exposures, there's a lot of back and forth with COVID rules. And that's really hard for kids with all types of anxiety, but especially generalized anxiety. So next, I want to talk about COVID anxiety. This might be related to generalized anxiety. And I also just want to say this is not a diagnosis. Some level of COVID anxiety is kind of normal. There's some gray area with COVID. So to help you manage COVID anxiety, it's helpful to find guidelines you agree with. This gives you factual information for your child. And this is really, really helpful because guidelines can change based off the current situation. So it can help explain to your child why there's a rule one week and not the other, and why, yes, this rule's been dropped, but these health people who know a lot about what they're talking about feel like this is safe. Guidelines also help you differentiate between appropriate caution, like washing hands for 30 seconds before eating, and anxiety, like washing hands 3 times in a row before eating. And we think of COVID anxiety, like kind of all types of anxiety, as becoming a problem when it's getting in the way. So particularly with COVID anxiety, thinking about if it's getting in the way of your family's expectations. So going to a park, having them go to school, and it can be helpful to consider what a sibling does as a comparison. So as I mentioned, anxiety also has physical symptoms. Kids might think they're sick because they actually really feel sick. Sometimes kids have trouble identifying the feeling of anxiety, and they might just say, I have a tummy ache. And for some kids, they even throw up when they're feeling nervous. And if a child complains of physical symptoms like stomach aches, headaches, or trouble sleeping, it could be helpful to talk to the doctor to make sure there isn't a medical cause. But, you can also kind of pay attention to when this is happening. So if a child really is only feeling sick around the time of a stressor, it's likely that they're not actually physically sick. So if they're always feeling sick the day of a big test, they probably don't actually have a stomach bug. And as I also mentioned, anxiety can look like behavior or attention problems. So when kids feel anxious, they might get grumpy or irritable. So for example, asking a child who's procrastinating homework to start working might get the reaction, Dad, go away. This irritability can also lead to a temper tantrum. Younger kids, that can look like an actual temper tantrum. For older teens, that can look like a lot of teen angst, which, is common to begin with. And for kids who worry a lot, they might also have trouble paying attention to things. You might also notice that kids who are anxious fidget a lot or bounce their legs. So these behaviors might not always be anxiety. Sometimes it's just a kid being a kid. Kids are wiggly, or it's a sign of a bigger attention problem. So how do you know if these behaviors are anxiety? So you, again, consider if they're just acting that way when they're feeling anxious. So we see plenty of kids in our clinic who are usually very well-behaved kids, but when they get anxious, they'll do anything they can to get out of that situation that makes them feel nervous, including being less well-behaved. I just want to also emphasize, though, that while understanding the cause of the behavior is helpful, that doesn't mean that behavior is okay. So we say all emotions are valid, all behaviors are not. It's okay to have an emotion. It's how we respond to the emotion that matters. And as a parent, you can validate the emotion behind a behavior. So if a child's really giving you a lot of attitude about something, it's really tempting to kind of get involved and argue. But instead, sometimes it's helpful to think about maybe this is a time to drop the rope and instead just say, I can tell you're feeling really nervous about the situation. And that can sometimes help calm them down. Along with behavior problems, sometimes kids refuse to go to school because they're feeling anxious. So to figure out how to help a child who's refusing to go to school, you have to first figure out, why aren't they going? Is there something about school that makes them nervous? Kids might feel nervous about being away from parents, socializing with peers, or getting assignments done. In other words, many types of anxiety can lead a child to not want to go to school. School refusal, though, also might be because school is boring and it has nothing to do with anxiety. So we want to make sure that staying home from school isn't more fun than going to school. So on days when they're not at school due to anxiety, it's best if the child still does schoolwork during school hours rather than being able to play video games or sleep all day. And when school refusal is related to anxiety, though, it's often a sign of a deeper problem. So I'll talk about some strategies that can help, and I'll use school as an example with this. I just want to mention, though, that it can be hard to deal with school refusal without additional support, especially for kids who are missing a lot of school. So sometimes missing a lot of school is a sign that it might be helpful to see a therapist. So before I get into strategies for anxiety, I just want to summarize when anxiety becomes a problem. And this is when kids start to avoid the things that make them feel anxious. And it makes sense that kids avoid things that make them feel nervous. They feel better in the short term. However, this avoidance means that they don't learn that the situation wasn't as bad as they thought, or even if it was hard, that they could handle it. So a lot of the tips I'll be talking about are to help break this cycle of anxious avoidance. I also like to mention this cycle is because we often get questions about, is anxiety a learned behavior or is it genetic? And both genes and environment do play a role. So a child might be kind of predisposed or have anxious tendencies, but it's when kids start to avoid situations that make them feel nervous that anxiety starts to become a problem. I also like to describe this problem because parents also sometimes wonder, is anxiety my fault? And the answer to this is no, it's not. A good way to know this is that two parents could treat two kids the same way, and one child's anxious and the other isn't. So while parents don't cause their child's anxiety, they can absolutely help their child cope with anxiety. All right, so I'm now going to go over some strategies you can use to help. And given there's a lot going on right now, it's starting to get to the end of the school year, it's kind of a tiring time. Think about picking just one of these to try. So consider, what might fit in the best with how your family currently parents. You know your child and your family the best. So think about what strategy might be the most helpful for you to try as something different. These strategies can be helpful both to help with anxiety and to prevent anxiety. The aim of all these strategies is to prevent avoidance behaviors. I'll also just mention that these strategies are for caregivers. So these are the things you can do and the behaviors that you can change to help your child. And that's because those are the things that are in your control. This said, I know a lot of parents want more resources of coping skills for their child. So I'll talk through some different self-help options that I recommend as well. So the first strategy is to label and validate emotions. And one question that was submitted ahead of time was about how to encourage a child while remaining supportive through the anxiety. And so this is the strategy I recommend for this, labeling and validating their emotion. So the reason why we recommend this is because kids often have trouble identifying anxiety, especially younger kids, and they might even think they're sick. So helping kids identify emotions helps them learn to cope with them. This is helpful, though, for kids of all ages. It's helpful for adults, too, to learn to identify emotions if that's something they struggle with. And when you label an emotion, it's important to be compassionate. So while you may know a situation isn't scary, it might seem scary for the child. So parents often say really well-meaning things like, don't be silly, there's nothing to be nervous about, but that can kind of unintentionally minimize the child's distress. At the same time of validating their emotions, we want to express confidence that a child can handle a tough situation. So the formula we recommend is to both validate and express confidence. It's easy for parents to jump straight into one or another. So in two-parent households, you may notice that one parent is really validating, like, oh, I know this is so hard for you. And the other one's kind of the cheerleader of like, you got this, don't worry, there's nothing to be worried about, but isn't really validating at the same time. And the reason why we encourage to do both together is because that tells your child, wow, my parent knows how tricky this is for me, and they still think it's that I can handle it. The other thing I want to point out with this strategy is we got a question about how do you help a child in the moment when they're feeling really, really anxious, especially, if they're having a tantrum or they're having panic attacks. Deep breathing is a great strategy, but oftentimes in the moment, that's a hard strategy to use if the child hasn't practiced it outside of that time. And so sometimes what a parent really just has to do in that moment, and this is so, so hard, is just sit there with the child until anxiety passes. And letting the child feel that emotion is the most helpful thing to do because emotions kind of go up and then they always come down. And it's actually helpful for a child to learn that that's the pattern because then emotions aren't so scary because they eventually do go down. This is also true for panic attacks. Panic attacks, those symptoms go up and then down. But so during that time, it's really, really hard for parents to watch this because your child's distressed. It's a parent's instinct to find that hard. And so you can label and validate their emotion. I can tell that this is a really hard moment for you, that you're feeling really nervous. And I know you can handle this feeling. It will go down soon. So let's give an example related to schoolwork. So here you can see that the parent labels the emotion. It looks like you're feeling pretty nervous about completing all the school assignments, validates the emotion. I know how hard these assignments can be, and expresses confidence and encourages approach. So even though it's hard, I know you can do this. That last bit, even though it's hard, I know you can do this, is kind of the summary of this whole strategy. So if a child's coming to you, after dinner and they're really nervous about school assignments, this could be something you could say to them. That said, sometimes you kind of need to add an extra piece to this. So to encourage your child to approach things that make them feel nervous, we recommend breaking things down into steps. So the strategy is really great with homework because oftentimes kids might not know where to start. So as I mentioned, the reason why this strategy is great is because avoiding situations makes anxiety worse. But oftentimes kids feel anxious because a full situation is too hard and they don't know where to start. So this is often what happens with homework meltdowns. Kids just don't know where to start. That's a hard skill, figuring out, how do I organize my homework and figure out, what piece to start with. If a child has a big emotional reaction in a situation, it's also usually because the situation is too hard for them. So I always, the other reason why when it's too hard and they have that big emotional reaction, I like thinking of this as a prevention strategy. So it's really hard to help a child when they're having that emotional reaction. So we want to think ahead of time about how can we break this situation down into a more manageable situation while we're still helping them approach that situation that makes them feel nervous without them getting so nervous that they're kind of in a state where they can't calm themselves down. So thinking ahead of time can help prevent those big emotional states. So how do we do this? We need to find smaller, more manageable steps that still encourage them to approach situations. So in therapy, we call this process challenges or exposures, but caregivers can do this too. So the first thing we need to do is to identify a reasonable starting point. So as I've alluded to a little bit, a starting point is something that's going to make them feel a little bit nervous, but something they're likely to succeed in doing. So by pushing them, but not picking something too hard, they can then feel proud of themselves when they do approach a situation. Oftentimes I see when I do this process with kids over and over, it actually raises their confidence because they're learning that they can handle things that they didn't think they could. The goal of this is to learn that it wasn't as hard as they thought, or even if it was hard, that they could handle it. So we want to find situations that they're likely to succeed in. And you can involve your child in this process. Ask them what's a good first step, reminding them it's something that should make them feel a little nervous, but they can handle. You can propose something that's maybe medium hard so you don't undershoot what they can handle. And then make it easier until the child does feel like they can handle it while still feeling a little bit nervous. And then you want to keep raising the bar as the child can handle those easier situations. And it's important to practice facing fears. So like with anything, the more we try hard things, the easier a situation gets. So with this practice, sometimes that can be in real life situations, you can break them down. But for some kids too, it can be helpful to do like kind of mock situations where they can practice facing fears without actually it being in that situation. So if they're nervous about calling a friend, you could talk through, okay, what are you going to say to them? So that they can practice that conversation. There was a question that's submitted ahead of time about accommodations in schools and what's helpful and what isn't helpful. Breaking situations down into pieces is one of my favorite accommodations. So the teacher can work with the child to break down a large situation into smaller pieces while encouraging the child to approach that situation. So what might this look like? Let's use an example of going to school. So the first step might be visiting public places like the grocery store or parks. And include this step if a child isn't really leaving the house very much recently. The second step might be visiting the school outside the school day. And that's to help them get more familiar with the building if they're associating with something that makes them feel anxious. And this might require working with the school to think about when they can go, especially during COVID times. The next step might be driving to school with their best friend, but only attending a half day. So driving to school with a friend, that's supposed to make something that's hard for them more fun. So sometimes the hardest part is getting in the door, so why not make that fun? I also just mentioned this because with a lot of these practice with breaking things down into pieces, we want to make this fun. Sometimes it's, a really tense moment because the child's feeling nervous, the parent's feeling nervous. But I just encourage you, if we think a little bit, take a step back. Is there ways we can kind of laugh about this with the child a little bit? and have fun as we're trying to practicing this. Now, the second part of that step 3, attending only a half day. So this is something that can happen if a full day of school feels too hard for the child right now. And the key word is right now. It's not a permanent change that the child only does half days, but it's something that might only happen for a week or two. So this is not something I'd ever encourage to be written into a 504 plan or IEP because it's a temporary support. So step 4 might be having the child go into school all day, but calling parents twice if needed. So again, those phone calls to parents aren't going to be in the plan forever, but if it makes it easier for a child to get through the school day when they otherwise wouldn't, this support can be temporarily in place. And you might need to break down this plan even further, like only attending the first hour of class. You can think about what's going to be something you feel like your child can handle, and also something you feel like you can handle based on how distressed they're going to be. And along with this plan, it's helpful to focus on the positive things at school. So being with friends, learning a favorite subject, playing with recess. Before school each day, ask them what are they excited about? It's what's going to motivate them to face their fears. The other reason I mentioned thinking about the positive aspects is because sometimes when kids are anxious, families can talk a lot about the anxiety, which makes a lot of sense. They're trying to figure out how to decrease the anxiety. But sometimes it's helpful, especially with younger kids, to shift the focus a little bit about what do you like about school? They can have that worry and still have something that they like about school. All right, here's an example with giving a presentation. So the key with this example, by the way, is not asking the teacher to give a different assignment that doesn't involve a presentation. And that's because it wouldn't allow the child to face their fear and also learn a new skill. It's important to give presentations. A lot of people have to do that throughout either their education or their career. So first step might be practicing a presentation in front of a caregiver, teacher, or small group. And then you can gradually increase the size or the difficulty of the audience. So maybe grandpa's kind of a tough audience, so that could be a good, harder person to practice in front of. Then step 3 could be allowing the child to go first or last when presenting in front of the whole class. So this makes it a little bit easier, but they're still facing their fear. And eventually we'd want to have the child go in any order like the rest of the class. If you need to break down the situation even more, you could have the child practice in front of a friend, a sibling, for younger kids, maybe pets or stuffed animals. All right, so I want to talk now about avoiding unhelpful accommodations. So to be really clear, many accommodations are very helpful and often necessary. But in the context of anxiety, some accommodations are what we call accommodating accommodations. So what I mean when I say this is that this is ways that parents or other people change their behavior to make their child feel less anxious. This might involve participating in anxiety, so sleeping next to your child if they're feeling too nervous to sleep alone, or changing your family schedule, so not inviting friends over because of social anxiety, or making very detailed schedules for a child who worries about uncertainty in plans. I want to just normalize, though, that almost all parents of anxious children accommodate. It's perfectly natural. Anxiety really pulls from this response from parents, both because we feel bad when kids feel anxious, or for kids who have more temper tantrums when they're anxious. That's a really hard situation, and it makes sense parents will want to avoid that. So again, this doesn't mean that a child's anxiety is a parent's fault. You could do the same thing for a child who isn't anxious and it'd be fine. But the reason I'm talking about this is because these accommodations promote that anxious avoidance cycle that we want to avoid. So some accommodations might be necessary to help a child face their fears. We don't want a child to free fall, so we might need to give them a parachute, but we want to make sure we're not always needing to be there with a safety net for them. So how do you know if an accommodation is helpful? So this, by the way, is true both for parenting behaviors, but also if you're thinking about accommodations at school. So the idea is to teach a child that they can, the most important thing an anxious child can learn, that they can cope with anxiety. So we want to have the accommodations be something that's helping them achieve a goal rather than removing expectations. We can ask, what do they need to be successful? What do they need to get through this situation, even if it wasn't the best job, rather than what do they need to be less upset? And so like with breaking situations down into steps, it's important to remove an accommodation if it's no longer needed to be successful. All right, so anxious kids ask a lot of reassurance-seeking questions. Did he think I was weird? Is mom okay? If mom just went to the grocery store. And sometimes this is because a child might worry because they don't understand the risks in a situation. So in these cases, you can provide facts at an age-appropriate level to clarify things for your kid. This is also where having family guidelines for things like COVID can help your family know what's anxiety versus what's safety precautions. However, other times, most of the time probably, there isn't a certain answer, or the child's asked the same question over and over and over and over again. So in this case, it's important to help your child learn to accept uncertainty. There's so many things in the world that are uncertain. So here, I want to encourage you to only respond to the question once. And then after that, ask your child to tell you what you said the last time they asked. They may not remember at first, so it's okay to tell them again, but this prompts them to pay attention to your answer. And even more importantly, it helps them respond to their worries on their own without needing a parent to feel better. But also, if a child's asking about things just because they don't understand a situation, asking them what they think helps them, explore and be curious and help them think through things on their own. So this all said, when the kids are asking about things because they're feeling uncertain, that feeling is really hard. No one likes the feeling of uncertainty. So you can also validate the uncertainty, but express confidence that they can handle it. So what might this look like? Let's say your child's starting a new sport like soccer, and they're worried that they won't have fun. And they've asked you if you think that they'll have fun at soccer for pretty much every day for the past week. So you're kind of starting to notice like this is getting frustrating. So you could say something like, I can tell you're feeling unsure about whether you'll have fun at soccer. What did I tell you the last time you asked? And by asking them to tell you, that's another way of even expressing confidence that they can handle it without needing you to step in. All right, so I'm a big fan of using rewards to increase brave behavior. So this is one of my favorite strategies. Rewards are helpful across all the strategies I described, especially when it involves a child facing their fears. So things like breaking situations down into steps, I encourage you to use rewards at the end of that. I want to just clarify a few things with rewards. First of all, rewards are not bribes. Bribes are desired things given before a task is complete. Rewards are given afterwards. And we use rewards to increase the frequency of a behavior. So it's not something we are going to do forever. But if you want to be seeing a child do something that you think they should already be doing, but they're not, rewards are a good way to increase them, the likelihood that they're going to do it the next time. And they don't have to be used forever. They're just used while you're helping the child do that behavior more until it kind of becomes something more intrinsic or natural for them to do. So rewards can even be praise. So with praise, I recommend praising the process, not the outcome. So praise brave behavior or working hard on homework rather than praising not embarrassing yourself, because we can't, control if we feel embarrassed. We also can't control what grades we get. We can just control studying really hard. And use labeled praise. So state what you're proud of them for. Rewards, though, also don't need to be expensive. Many rewards, and my favorite ones, are free. And I like rewards that are cheap or free because those are more sustainable. They're easier to use many times to be able to reward a child right away after they're doing something. So rewards can be privileges like extra screen time. I think that's my teenage client's favorite reward. They can be activity driven, like getting to pick what's for dinner, breakfast for dinner, going to the park with grandma. These rewards are great because they strengthen a family relationship. Rewards can also be stickers or extra dessert at night or getting, Starbucks or something like that. And especially if it's something like stickers for younger kids, you can use like a points chart. So every time they do something, maybe they get a sticker and 10 stickers equals something bigger. For older kids, they do something, they get a point and 10 points can equal something bigger. Rewards are super helpful and effective parenting tool, but it's hard to reward kids if they're already getting everything they want. So sometimes this might mean pulling back on privileges. Because I mentioned screen time as a reward, I just want to give a few quick tips with screen time. So parents might want to give kids an hour because they're a kid and they deserve to have fun. It's how they socialize with friends, especially for teenagers. But then the rest they can earn for facing their fears or doing homework. That hour is an arbitrary number. You can think about what makes sense for your family. So we'll be giving you a resource handout, and there's a really great screen time tool by the American Academy of Pediatrics in that handout. It can help you figure out how to set screen time guidelines with your child and family. So it includes things like a screen time free zone, like dinner in the car where no one goes on their phone, which is nice for family bonding. All right, my last tip is perhaps the hardest, but it's a really important one. So it's so normal to get upset or frustrated when a child is anxious. Sometimes you just need to get them to school and they're slowing down the process. But remember that these are emotions that your child's having. They aren't doing it intentionally. They're just having a hard time at the moment. So we encourage you to use your own coping skills like deep breathing to stop you from getting angry or upset in the moment. Sometimes parents need to step out of the room to calm down so they don't accommodate. I've had parents tell me like, Margaret, I'm a little embarrassed. I had to shut myself in the car for a little bit. And I actually think sometimes that's a great strategy. Parents need a break sometimes. And these coping skills, including things like taking a break, are also great because they help you model the behavior you want your child to see, you want your child to do when they're feeling upset. So it's a great strategy of teenagers when they're feeling upset actually do go to their room to calm down and then come back downstairs later when they're feeling better. I had a question ahead of time about how to react to anxiety, a child's anxiety when you're feeling anxious too. So this is again where I encourage you to remember your own coping skills. So just trying to pause for a second before reacting. I think even that moment of pause can help parents calm down a little bit. This all said, I also just want to remind you it's really, really hard. It's hard being a parent of an anxious child. And so, I think sometimes when parents then look back on what they did, they can be really hard on themselves. And just as a reminder, like you're doing your best. It's really hard having an anxious child. Even the fact you're here tonight, or if you're watching this presentation later, that's a good sign that you're doing your best and really trying to help your kid. The other reason I like breaks again is because I kind of mentioned this, but it's hard coping when we're feeling really distressed. So if we take a break, we can then come back to it later and cope a little bit more. So that's true with parents, it's true with kids as well. All right, so in this section, I'll be talking about how to know when additional support is needed, what options you have, and how to find a therapist if you think that would help. So when is treatment needed? As I mentioned at the beginning, anxiety is kind of normal. Not all anxious kids need to be going to a therapist. So we think about a child might needing additional support if their current coping skills aren't doing enough to help with anxiety. So let's say you've tried a lot of the strategies I just mentioned and the child's still feeling anxious. That could be a good time to reach out for extra help. We also think about, is anxiety getting in the way of things like school, friends, or at home, or even your life? Are we starting to see that anxious avoidance cycle? And is that anxious avoidance cycle getting worse? They're avoiding more things rather than facing their fears slowly. We also ask, is the anxiety causing the child or you a lot of distress? So in other words, if anxiety is starting to feel like a big part of the child's life, it might be a good time to reach out for extra help. The good news is we have effective treatments for anxiety. Anxiety can be treated either with medication or therapy. Research shows that meds and therapy are equally effective, and some kids may need both meds and therapy. In research, the combination of meds and therapy does lead to a better outcome than either alone. This said, guidelines suggest starting with therapy because it has fewer side effects. There are many different types of therapy, and different types of therapists use different strategies and approach things different ways. I'm going to be talking tonight about cognitive behavior therapy with exposures, because that's a type of therapy that research suggests works best. So we're going to be talking about it today. This doesn't mean it's the only type of therapy that can be helpful. So if you've been to a different kind of therapist and it's been helpful, that's great. Different things work for different people. I'm recommending CBT because it's the most likely to work for the most people and it's most likely to work the fastest. So what does cognitive behavior therapy or CBT look like? It's based off the idea that there are 3 aspects to anxiety, so it gives a strategy for each of those. So there's the physical piece. Anxiety makes people feel revved up or nervous in their body. So to help with that, the therapist may use relaxation strategies like mindfulness or breathing exercises. Then there's the cognitive piece or the thinking piece. So anxious kids expect bad things to happen. They have kind of an incredible ability to see the potential worst case scenario in situations. So to help with this, therapists use something called flexible thinking. Technical term for this is cognitive restructuring. So what this is that it helps kids think about how realistic or how helpful is a thought. And then they help come up with a more realistic or more helpful coping thought. So for example, if a child's thinking, I'm going to fail tomorrow's test, a coping thought could be, I've studied my hardest, so maybe it won't be as hard as I think. The last piece is the behavioral piece. That's the B in CBT. So anxious kids avoid things that make them feel nervous. So to help with this, there's 2 main strategies that therapists use. The first is problem solving. So this could include breaking situations down into smaller pieces, like I talked about. Sometimes it also includes brainstorming solutions and picking the best option to try. So can we make this situation a little easier for the child where they can still approach the situation? And then the second strategy is gradual exposure, in which a child slowly faces their fears with a therapist. And I've underlined exposure here because it's the key part of CBT. It's the strategy we know works best, but it's also unfortunately the strategy that most therapists are not trained in. So I'm talking about what does CBT look like because I want you to be able to kind of identify as my child's therapist if you have one doing this really well. Because if they're not, it could be, and you're not finding that it's helpful, that could be a good sign that maybe there actually is something that could be more helpful. And with exposure, what that actually looks like in practice is pretty much what I just described with breaking things down into smaller pieces. So those 2 examples of going to school and giving a presentation, those were 2 things that were from not real clients, but a combination of different things I've done with clients. But that would be how I'd actually do it in therapy. And I'd slowly work through it and practice it with the child, and then they practice it at home. So what's covered in CBT? So there's a cat on this slide because the treatment our clinic uses is called the coping cat. So that's the coping cat. So the first half is something called psychoeducation. And so this is where a child and their family learn about anxiety and coping skills that can help. So this includes recognizing the connection between thoughts, feelings, and physical reactions in situations that make a child feel anxious. It also includes teaching coping strategies that I just talked about, so relaxation, flexible thinking, problem solving. And then the second half, once the child has more coping skills, they're going to put them into practice during those exposures. So again, a child's going to slowly face their fears. And I want to also just emphasize here that all of CBT is really going to be tailored to the specific child's worries. And this is especially true with exposures. So I've never done exposure therapy the same way with two different kids. CBT has a standard structure. It's short-term and goal-oriented, meaning that the therapist focuses on the problems that are impacting the child's life the most right now. This is what makes CBT a little bit different from other types of therapy too, in that it's really focusing more on getting the kid back into their daily life. And that's because CBT therapists have the belief that therapy doesn't have to go on and on forever. And in fact, the goal of CBT is to give the child and the family skills that they can keep using after therapy ends. Therapy often might last 1 hour a week for maybe 16 to 20 weeks, depending on the child, but the exact length is really going to depend on what the child has going on. So for just anxiety, that could be a case. If a child has many things going on, therapy might last a little bit longer. It's manualized, meaning that there's a certain type of skill, certain set of skills that are used, but these skills are going to be really tailored to the child. So the nice thing is that all kids learn these same skills. It's hard to know what's going to really click with a child and work best. But those examples and even the specific strategies are really going to be customized to the child. So the way I describe these skills depends on the child. I'll use examples from the child's life. If I can tell a child resonates with one type of skill more than the other, I'll bring that in throughout therapy. CBT includes therapy homework. So this is something that is different than other types of therapy. And so what this is, though, is it's just things that a child can do to practice outside a session. So like with learning anything, the more a child practices, the easier it gets. Therapy is only 1 hour a week, and then there's the rest of the child's life. So we also want to make sure the child is practicing to help them generalize the skills. So if a therapist isn't giving therapy homework, they're likely not doing CBT well. And so I want to help you know what to look for in a good CBT provider. Caregivers are also involved in treatment. I give you a heads up about this because sometimes parents, when I ask them to come in, they're like, did I do something wrong? And the answer is no. In fact, the exact opposite. You can give really helpful feedback about the child's anxiety. We might have some tools, but you know your child best. So we want to work together to figure out how can we make this fit for your family. Caregivers also help the child use the therapy skills outside of sessions. So especially with younger kids, caregivers might be a little bit more involved because we want to make sure they understand the skills so the child can keep using it. And the therapist's goal overall is to give the skills to the family so they can keep using those skills after the therapy ends. All right, I want to talk a little bit about medication because this is another option too. Before I dive into this, I just want to say I am not someone who prescribes medication. So I'm talking about this based off of general guidelines, not based off of anything that I personally do. So guidelines suggest the first medication to try is an SSRI, or selective serotonin reuptake inhibitor. An example of that is Zoloft or sertraline. And what these medicines do is they help regulate neurotransmitters or chemical messengers in the brain. These meds are also called antidepressants, and this is confusing because they're the ones that work best for anxiety. So for anxiety, the first line isn't an anti-anxiety, it's an antidepressant. And there are many different types of SSRIs, and some meds work better for some kids than others. So you want to work with a doctor to figure out what medication works best for your child. And medications for kids are usually managed by pediatricians or psychiatrists, sometimes nurse practitioners as well. SSRIs are well tolerated, meaning there aren't many side effects based off of both being used for a while and also many studies. They do take around 1 to 2 months to start working, so it's not a magic pill. Guidelines also suggest checking in with your doctor after a child's been on medication for around a year to see if the dose can be lowered. A child doesn't necessarily have to be on medication forever. I know that's something that some parents worry about. All right, so let's say you're interested in having your child see a therapist. Sometimes the hardest part is actually finding that therapist. So we'll be sending you a handout, and the first page of that handout is just a list of therapy clinics that we recommend. So these are clinics that both offer cognitive behavior therapy with exposures, have a relatively short wait list, and hopefully at least some of the options don't charge a lot of money. So some of the options on this list under the sliding scale are university training clinics. And these are really great options, and the ones I actually recommend to friends and family because they offer the most up-to-date effective therapy, they have shorter wait lists, and they charge lower fees. Also, because these are trainees, they might have fewer clients, so they're thinking a lot about your child. And they also have a supervisor, someone who's more advanced, who's giving advice on how to help your child. So there's a lot of people thinking about how to help. There's also options for therapists who take insurance. So I've listed some that both take private health insurance plans and then also Medicaid. I will though say that a lot of therapists who offer the most effective therapy unfortunately don't take insurance. And I just want to give you a heads up about this. And also, that's why I had the options on the first slide about training clinics, because those are more affordable options. And again, they do provide really great therapy. But for some parents, they might think, okay, I've tried a few different therapists. Maybe I do want to try a therapist, even though they're out of my network. So these are some different options in Philadelphia, Pennsylvania, and then New Jersey. I've also included an option for more intensive treatment, which is Rogers. Rogers is fantastic, and it's really the main clinic in the area I'd recommend for a higher level of care. If that is something you're feeling like a child needs because anxiety is so severe, or because they've tried a lot of outpatient therapy and it's really been not very helpful, and anxiety is really impacting kind of all areas of their life, or they're having suicidal thoughts, for example. Suicidal thoughts, though, don't necessarily mean they need that higher level of care. We can talk more about that in the Q&A if you do have specific questions. All right, so let's say you want to look at other options. And this is something that I also might encourage because sometimes those clinics can have longer wait lists and you want to have your child see someone now, which makes perfect sense. That, I think is a great option while you're waiting to get into a clinic that might offer a little bit more effective therapy. And some of these other clinics can offer really great services too. So where can you look? The answer is kind of in some ways anywhere for this. So you can ask your child's pediatrician, your school's counselor, social worker, school psychologist. You can ask a friend. I think that's how a lot of families find out about therapists. We find out sometimes that people will post on Facebook too, or in different Facebook caregiver groups, or the internet as well. It talks about some different directories. So when you're looking at other options, just do remember that some therapies work better than others for youth anxiety. So be sure to ask if the therapist does cognitive behavior therapy with exposures. You also want to make sure that you find a therapist who's either licensed or supervised by someone who's licensed. And that's because anyone, including someone without training, can call themselves a therapist or a life coach. And so a therapist license tells you that they've had advanced training. There are many different types of therapist licenses, and I think that's kind of confusing for families. And the long of the short of it is that it doesn't really matter what kind of license they have. So you might see a licensed psychologist, psychiatrist, social worker, counselor, marriage and family therapist. The exact degree really doesn't matter. It doesn't affect how good of a therapist they're going to be. It's more important that they've been trained in using effective therapies. So if you're looking at the internet, here are a few websites I recommend. The first two, Anxiety and Depression Association of America, an Association for Behavior and Cognitive Therapies. These are the best for finding therapists who do effective therapy. Unfortunately, a lot of these therapists don't take insurance and can cost $180 or $150 or more a session. These websites, though, also have really great resources on youth mental health and other types of, anxiety too. So they have some really good handouts on that too. Psychology Today has a really great filter function where you can filter by types of insurance, and it has a really nice description of therapists too. So you can see if you like their style and how they describe their treatment approach. That said, a lot of therapists are going to check every different type of treatment option. And that kind of indicates that they probably aren't particularly focused on one option. They just pull from a bunch of different things, which could be helpful. It depends a lot on the therapist. And then this website, Therapy for the People, is a relatively new database. It's one I really love. And that's because it includes mental health services that cost less than $30. So a lot of those training clinics might be on that list. And this database also includes some self-help options or support groups too. And then the last one is your insurance company's Find a Doctor page. There's usually not a lot of information about therapists on this page, but it's a good way to make sure a therapist is covered. I will say sometimes parents can be frustrated that can be a little bit out of date, but it is a good place to try and look first. So like with these last options, as I've said on the last slide, and I'm kind of repeating, not everyone does offer the most effective therapy. So do ask if the therapist does cognitive behavior therapy with exposures. That's what I would be asking for if I were seeking therapy for my child. So I want to make sure you know what to look for. So let's say you found a therapist you think might be a good fit. Before scheduling, I encourage you to ask some questions to make sure that they are indeed going to be the best person. So you're empowered to ask these questions. You're going to be paying this person. So the first question is, have you treated a child with X problem from Y background? And that's because you want to make sure they have experience treating kids who might be similar to your child so that they can understand your child's problem in context. What languages do you speak? Of course, that's important. How long do you usually see clients for? Therapy doesn't have to go on and on forever. This question can indicate if they might use a treatment that research has shown works. It also kind of just gives you a heads up about what's their style. Do you use evidence-based treatments? This is a technical term you might see on some therapist websites. This just means treatments that work. So for anxiety, that's cognitive behavior therapy. Do you give therapy homework? As I mentioned, good CBT does because it lets your child practice what they're learning at home. Will you provide a treatment plan? This indicates a more structured approach. It also helps you make sure you're on the same page about goals. So if a therapist tells you the plan and comes to you and says, okay, we're going to start working on depression, and you're thinking, no, my child's not sad. They're not doing very much because they're so anxious. That's a good time to check in and make sure you're on the same page. Did your training include supervised experience? This indicates a higher level of training or expertise. This is particularly important if the therapist is using exposures. It's kind of hard to know how to tailor exposures to the child. So supervision or advanced training, so talking to someone who's further along, helps the therapist know how to tailor exposures to your child's exact needs. So it both feels relevant to your child, but also isn't too hard or isn't too easy. What's your fee? Do you take insurance? Cost matters. Therapy, though, doesn't have to be very expensive. So even if your insurance doesn't cover a therapist, you could also have options like training clinics too. If you're going through insurance, do check with them about how many sessions they'll cover. If they're only covering the therapist at a network, make sure you know how much they're going to reimburse you for. Sometimes an insurance company's reimbursement rate is lower than the therapist fee. Many therapists offer services on a sliding scale, especially with training clinics, and so ask for fee reductions if needed. So if you're quoted an amount that you can't really afford, talk to the therapist about that. Oftentimes they might have other options for you. Hospitals also have something called charity care, so you can get free or reduced services, and immigration status doesn't matter for this. And it also doesn't get shared with immigration authorities. Then this last question is one I've added since COVID, which is, do you offer therapy in person? And if it's telehealth, how long do you plan on continuing telehealth? There are pros and cons of telehealth. It's really convenient, but some kids engage better in person. For example, if you found a child had a lot of trouble with remote school and didn't pay attention, they might have trouble with telehealth, but you never know. It's that all said, it's just good to know what options a therapist offers now and what they're going to continue offering in the future, so that if the therapist is a little further away but offers telehealth, but they're going to stop doing that in a few months, it might not be the right fit. And this last question is one I'm going to keep emphasizing, which is, do you do exposure therapy? So this is kind of behavior therapy, particularly with exposures. And I'm keeping emphasizing this because exposure therapy, again, is the most effective strategy. But a lot of people, in CBT, a lot of people say they do CBT. They might use kind of a CBT framework or do parts of CBT. So they'll say that they do cognitive behavior therapy, but if they're not doing exposures, they're not doing the most effective part. And if you're not sure if they actually offer CBT with exposures, you can ask them, what does an in-session exposure look like? They should be able to give you examples. This question is also helpful because some therapists only kind of assign exposures as homework. And I find this a little bit confusing because I think it's really helpful to do this together with the client to see how the client reacts, because sometimes something we think is going to be easy is actually really hard for the child. So it's helpful that we know how they react so that we can then give the family different skills or also tailor it. I also like in-session exposures because sometimes we involve caregivers. So for parents who have a lot of trouble with anxiety, sometimes it's a challenge for them too. And so we'll bring them in so they can see what the therapist does in session and so that they can practice having the child be nervous in front of them. All right, what does the process look like to start therapy? So I'm giving you a heads up on this because unfortunately it is not the best process in the world. I wish we could improve this. In fact, it's something I hope we will improve. The first thing is just that wait lists are common. So oftentimes, especially therapists who offer more effective treatments might have wait lists that can be 3 to 4 or even more months long. That said, there's often, kind of diamonds that you can find of that their wait lists aren't as long. Some of the clinics on the list, when we last checked, I think in April, didn't have quite so long wait lists. Um, so, our recommendation is just to get on many of them. And that's because sometimes wait lists move faster than the providers think, and just because, you want to make sure you're covered. And you can also sometimes get on a wait list for a therapist that does CBT while then starting therapy with a therapist who's doing more kind of supportive therapy. So maybe he's doing a less structured approach, but that's still going to be really helpful in the meantime. I'll also talk a little bit about self-help resources. And then most clinics have an intake process. So I want to give you a heads up on this because it can feel like repeating information. So it's kind of frustrating. So if you're, have been through this process and you felt like it's frustrating, I just want to validate that. And if you've been avoiding this process because it's going to be a headache, I also want to validate that. Like, it is a really annoying process. So it makes sense that you've been procrastinating it a little bit. So first, oftentimes clinics are going to do some sort of screening. So this could be 5 to 20 minutes long. And that's because they want to make sure that they have a provider who's going to be the right fit for your family. And then the first session might be like a longer intake, like 50 minutes or longer. And that might include a bunch of different questions. And so, that might be a little bit less, enjoyable, or, you might be feeling like I didn't get as much out of that. But that's because we want to ask a lot of questions so that we have an overview of what's going on, so we know what to prioritize. A lot of families actually also find that helpful so that they can kind of straighten out lots of things that are going on and figure out what is their top problem. Once therapy started, the first session, I also want to give you a heads up, might be more like playing games or fun get to know you questions. And this is because therapists are going to ask kids to do hard things. So it's important we have a good trusting relationship with them. So I give you a heads up on this because sometimes therapists are like, did you do anything with my child? And the answer is I'm building a relationship. I also mention this because it eases kids into the process. So kids might be unsure about whether they'll like the therapy. So it's helpful if the first session's fun to kind of ease them in. Many therapists might play games at the end of therapy. And that's to make therapy a little bit more fun and to reward the child for their hard work. So again, if your child comes out of the therapy session being like, oh, we played games, like that's not always a bad thing. If therapy can be fun, that's great. It could be helpful to check in and see like, what did you learn? Or checking in with a therapist about, did you do more than just play chess with my child? All right. And then once therapy is started, I want to empower you to kind of check for fit and make sure this is the best therapist for your child. So does the child like the therapist? Do you like the therapist? Ideally, you want to find someone that both creates a space that the child can feel safe, but also that they push the child out of their comfort zone so they can grow. And it's okay to try a few therapists. Finding a therapist can be a little bit like dating. Not everyone's the right match for the right person. If you're feeling like after the first session or two that you just really don't vibe with them, I'd encourage you to switch pretty quickly. Oftentimes that doesn't necessarily get better. Sometimes it does though. So sometimes you're like, I feel like I don't totally know if I'm on the same page, but I like a lot of the things they do, it could be worth continuing, but also just have a conversation. And then also look for progress. So as I said, with having a conversation, I encourage you to talk to the therapist if you're not seeing as much progress as you'd like. This could be helpful information for their therapist to try something else, or it might also be something they've noticed and they can give you feedback on what they're planning on doing to make therapy more helpful in the future. If you're not seeing progress after a few months, you might want to consider switching providers. But let's say after 5 or so sessions, the child really just isn't talking at all to the therapist. It's worth it to talk to the therapist about, can they try something new? Or, maybe they feel like they've helped the child as much as they can and they can recommend other providers. Or there's other therapy approaches that just involve working with the parent. There's a program called the SPACE program, which is on the resource handout, that, if a child really, really, really doesn't want to go to therapy, they just help a parent teach the child, change their behavior to help the child be a little bit less anxious. And that program was created because sometimes kids don't want to go. So all of this is to say that you want to check for a fit to make sure it is feeling like the best use of your time, and talk to the therapist if you're not seeing as much progress as you'd like. All right, so I mentioned this handout a few different times, but I just want to flag what's on this. So there's first of all the referral list, the therapist directories, but then there's some internet resources we like, and then there's also some books for caregivers and kids as well. So some of the self-help resources I just want to flag. So these are really great ones you can try either before starting therapy, or if you've kind of signed up for some different wait lists. These are some things you can try in the meantime. So for kids and teenagers, there are some books there. One of these books is for OCD as well. Um, and then for caregivers, there's two that I recommend the most. The first, the Resilience Recipe. This one is really good for teaching parents coping skills to teach their child, um, which is something I know a lot of parents really want more of. And then the second one is Breaking Free of Child Anxiety and OCD. And so this is a one that focuses on the caregiver's response. So this is a lot of kind of what I was talking about today. And the reason why this book is also helpful is because as caregivers, you can only do so much to change what a child is doing. And so it can be helpful to think about your own response because that's what you can actually control. And then this last slide I've added to the presentation because I've done my dissertation data on this presentation and also the treatment, the process of seeking treatment for families. And it's a hard process. So if you're unhappy with a system, it can just feel kind of demoralizing. And I just want to encourage you that you have a voice in this system by calling your representative. There really aren't enough mental health providers, unfortunately, to meet the current need. Insurance doesn't pay for therapists enough. And many therapists don't take insurance because they're not getting paid as much as they think they could be. So for this to change, the mental health system needs more funding. Politicians want to hear from their constituents. In other words, the people who elect them like you. So I don't want to add something to your to-do list, but if this is something you're passionate about, it is something you can be a big role in creating change. So I just want to mention a few bills that are on the plate right now, because if you want to contact your representatives, encourage them to vote for these bills. So the Mental Health Reform Reauthorization Act, this is a pretty broad act to increase mental health parity. So to help mental health services be funded more, to help also mental health services be located in pediatricians' offices, because that's really convenient. So call your House and Senate, both your House representative and senators. And then there's also two bills for mental health services in schools that are currently being reviewed by the Senate. So you could thank representatives if they've supported it, and then encourage your senator to support it as well. I don't know as much about things at the state level right now, but you can also contact those representatives too to tell them these are things you care about. These are things that you want them to prioritize in future legislation. And then I've also just included some links about how to find a representative and for more information. So just to recap, anxiety can present as worries, physical symptoms, and avoidance. The goal is to gradually help kids slowly face their fears. Cognitive behavior therapy and exposures and medication are both available and effective for kids who need extra support. So I just did talk about how the system could be improved. We do have treatments that we know can help kids now. And so I'd encourage you to seek those out if that would be helpful. Alrighty, so at this point, I'm gonna stop the recording and we're gonna move on to the